The Biden administration is taking new steps to reach its 4th of July vaccination goal. President Biden announced additional efforts during a virtual meeting with governors Tuesday. Some of those efforts include free Uber and Lyft rides for anyone heading to a vaccination site and funding for local governments. Meanwhile, top U.S. health officials appeared before lawmakers on Capitol Hill. The head of the CDC says average daily infections and reported deaths have both fallen more than 70% this year. But she warns variants could still set the country back. This comes as Pfizer awaits approval from the CDC to allow children ages 12 to 15 to receive its vaccine. Janet Shamlian reports.
Tonight, the country is ready to take a big step in the fight against COVID. If a CDC advisory gives the green light tomorrow, children as young as 12 could begin getting the Pfizer vaccine on Thursday. But one hospital system didn't wait for that. Cape Fear Valley Health in North Carolina started giving the vaccine to kids ages 12 to 15 today, before the CDC signed off.
Some parents won't want to be first, but I'm also encouraging children to ask for the vaccine. I have a 16-year-old myself, and I can tell you he wanted to get the vaccine. He wants his life back.
Pfizer says the vaccine is 100% effective in 12 to 15-year-olds, higher than for adults. Authorization would make close to 17 million children eligible immediately. Students like Ty Dropic, who took part in the Pfizer trial.
Most of my friends I've seen have felt a lot like I do, that they want to get the vaccine.
In a congressional hearing today that at times became heated.
You are entirely and completely incorrect.
The nation's top infectious disease doctor told senators he believes life could return to normal very soon. But National Institutes of Health Director Dr. Francis Collins says,
even though all over the country things are getting a bit better, it ain't over yet.
Because testing remains a priority, Collins says the NIH has just launched a first-of-its-kind trial of self-testing in Tennessee and North Carolina, aimed at reducing community spread.
What are you hoping that this trial in 2 counties will show you?
If they test positive, will they decide to change their behavior and not go to work or school that day? And will it actually result in a decrease in the transmission of COVID-19 in that community?
In Chattanooga, Dominique Blackburn picked up a box of the test, even though she's vaccinated. The 50-year-old is a school truant officer in contact with a lot of people. She has school-age children who haven't been vaccinated.
It gives me peace of mind that I don't have to always make an appointment with a doctor, but now I've got this kid at home and I can just test at home and we can know immediately.
What about the ease of just not having to find a testing center anymore?
Oh, that is a game changer for us.
This is a kit that they're handing out. Each of these boxes has 25 tests inside, and they give results in about 10 minutes. Here in the Chattanooga area, they've distributed some 250,000 tests already in a program that could be rolled out nationwide. Elaine?
Janet Shamlian, thank you. Dr. Amesh Adalja joins me now. He's an infectious disease expert and senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, welcome. In a meeting with governors, President Biden said one way to combat slowing vaccine demand is to, quote, draw a portrait of what Americans can do once they get vaccinated. How effective do you believe this will be? And is there something more federal and state officials could be doing to encourage inoculations?
To me, it's the single most important thing that we can do to encourage people to get the vaccines, is to show them what it's like to get your pre-pandemic life back, the life that you put on hold. And I think that we've been slow to do that. There have been many in my field who have really said nothing changes once you get the vaccine, and that's simply not true. And what I think needs to happen is people have to realize that this vaccine is something that is going to be of personal value to you. And we need to get the public health agencies like the CDC to be very proactive and show people what they can do. They're being very cautious, taking baby steps in the right direction, but still baby steps. I think we can be much more bold.
Well, the Biden administration is moving away from these mass vaccination sites and toward mobile units. Doctor, what kind of communities do you think will be reached with this approach?
This is going to be something that's important for rural communities where people may have to travel a long distance to get to a vaccination site. It's also going to be helpful in urban areas where people have a PCP's office, a primary care office, or a drugstore that's nearby that they trust that they can go to. It's also going to be something that makes it more convenient for people who might be procrastinating, who don't want to stand in a line, who don't want to register, because some places are still requiring you to make an appointment. We want to make this vaccine as easy to get as the flu vaccine, and I think that's one thing that will help to nudge some people who may not have gotten vaccinated yet to become vaccinated.
Meantime, a Pfizer executive says the company's coronavirus vaccine could become available to kids 2 years and older as early as this fall. And he also said the company is being, quote, deliberate and careful as it tests the vaccine on younger groups. How important is this? How delicate is a trial in young kids?
Well, you have to remember that the risk-benefit ratio is different for each age group. It's very different if you're vaccinating a 71-year-old versus vaccinating a 7-year-old, because children that young are generally spared from severe consequences of disease. They're not major spreaders of the infection. So you've got to get the dosing right. You've got to get the risk-benefit calculation right. You've got to understand about the multi-inflammatory syndrome, MIS, that can sometimes happen in children and how that relates to the vaccine. So there's a lot of nuance when you're dealing with that age group. And I think that's going to be something that takes some time to get all the data and to make that decision.
Well, according to the CDC, the daily average of new infections has dropped 76% since January. What will it take for this trend to stick, and are you hopeful that it will?
I do think it's going to stick. When you look at countries that are highly vaccinated, like Israel, when they crossed about 40% of their population fully vaccinated, they basically saw cases plummet, and the cases have not come back up, even in the face of more worrisome variants. So I do think as we close in on 40%, and I think we're around 33% or so, we will likely see this trajectory continue. Cases will become more and more rare, and already we've achieved the ability to not worry about hospital capacity because we've done so well with vaccinating our high-risk individuals. So everything is looking on track to go back to normal.
Well, the head of the CDC says while cases are trending down in the U.S., the global pandemic is, quote, more severe than ever. What more can the U.S. be doing on the global scale, and where should officials be directing those efforts?
The first thing the U.S. can do is to remove all export restrictions, to allow vaccines that are manufactured in the United States to be exported out of the United States. There are still some export restrictions that may be in place that could be hampering the supply chain. We also have to really think about what we're going to do with our stockpiles of, for example, the AstraZeneca vaccine, which is not approved for use in the U.S., but could be very useful in parts of the world. We have to continue to engage with the global health community, try to control this pandemic everywhere it's flaring, because the world will still be disrupted. The United States may have a good trajectory. Israel may have a good trajectory, but we're still going to have a disrupted world. Travel, trade, all of that is going to be on hold until this pandemic ends all over the world.
All right, Dr. Amesh Adalja. Dr. Adalja, thank you very much.
Thank you.